Proning technique, where the person lies upside down and it helps in better oxygen saturation. There's one video doing the rounds on the internet where this person claims to have benefits from this technique. Today in this video, we try to understand what does this technique really involve? Does it help COVID-19 patients? And can you do this at home? And in the end, who can not really attempt this technique? My name is Arun Singh and we have an expert, Dr. Anita Ramesh. She is Professor and Head Medical Oncology, Savitha Medical College, and Senior Medical Oncologist, Apollo Specialty Hospitals, Chennai. My first question, what is this technique really all about?
That what people have, the video has shown is not at all unscientific. This is a lot of science, and we as a medical physician, we are practicing in the ICU, and we are also doing with the COVID patient now as on today. So how do you lie down? Take 5 pillows. Okay, put one pillow below your chin and neck, 2 pillows around below the chest and the abdomen, and 1 pillow below your upper part of your leg. So that makes it 4 or 5 pillows according to your length and your height. And then put your head up and keep breathing. And you will see, though your pulse oximeter and the sitting position measured 94, now you will see it has come up to 96, 97, and continue breathing. Continue in this position for say 16 hours, 24 hours. Sometimes saturation becomes much better.
Important question, can we really do this at home without medical supervision?
No, it is, yes, what you can do, that's what I told the viewers. Now your oxygen saturation is falling from 94, 95, and you are waiting for a bed, or you're waiting for your doctor's appointment, and you know you have an appointment, you have to go. Instead of panicking at home, just lie down in the prone position, keep breathing. It will automatically make it go above 95, 96, and then slowly you go to the hospital. So it avoids panicking. It also helps you not your oxygen saturation not to fall, dip down so much. It improves the lung blood supply and oxygenation and keeps you active till you go to the hospital. Yes, Arun, we want to tell the viewers it is a technique to tide over the emergency condition. Okay, not to panic, not to run to the hospital. Do it till you reach the hospital. But this is not not your treatment at home. This is a treatment just to buy time before you reach hospital.
Okay, so you can call it a first aid. Last question. How is it really helpful for COVID patients? What does it do for them?
Yeah, see, as you know, in COVID patient, I also gave an example for even my cancer patients and for acute respiratory failure and any cause which leading to stiffness of the lung, where a person cannot take the breath and the oxygenation is not maintained due to some pathology in the lung. Even COVID does all the inflammatory changes in the lung, and that's why you get a hazy picture, ground glass opinion. So the lung is really not able to function properly. It's not, and the oxygenation is not happening. So we have to do something to improve the oxygen. And if you buy that 15 days of time, yes, you are out of the COVID pneumonia. So this, what happens, we need oxygen. And either I told you high flow oxygen or by nasal masks, or by doing some technique like this, which is a first aid technique, be in the prone position, improve your oxygen, then come to the hospital. Anyhow, once you come to the hospital, we are going to give you oxygen. We are also going to make you lie in the prone position and give high flow oxygen. So this position helps more aeration, blood supply to the lungs, and can be used as a first aid method. Definitely all of you should learn and practice it before you reach the hospital.
Thank you so very much, Doctor. It was great talking to you. In the end, one should avoid proning in conditions like pregnancy, deep venous thrombosis, major cardiac conditions, unstable spine, femur, or pelvic fractures. That's all we had for this video. I'm Arun Singh. It's a goodbye from my side.